Hi all, in today class we are going to discuss principle of blood pressure measurement. Before getting into what are the different methods or techniques or methodologies are there to measure BP, first and foremost we should know what is the basic concept which is behind to measure the blood pressure, right? So in order to measure the blood pressure, we have a common device that we might all know, like whenever we go hospitals for any reason, for any type of disease or disorder, first and foremost they will check your BP, right, by using one device that is nothing but sphygmomanometer, or you can say BP measurement, BP apparatus. Okay, that sphygmomanometer device comprises of one cuff which is going to be placed over the arm, and you have mercury meters through which you will get to know what is the mmHg, that is the level of BP, systolic and diastolic, by moving by rising up and rising down that mercury level according to the pressure what we are doing. And other end you will be having air tube and then bulb connection. So by pressing the bulb, you will increasing, that is you are inflating the cuff, and by releasing the bulb, you will be like deflating the cuff. So this is the actual BP apparatus main components. So now we are getting into like measurement, how we are going to measure this BP with the help of this sphygmomanometer. In this way we will be get to know what is the basic principle which is lie behind this. Okay, so initially if you see, before applying this apparatus, how does our blood flow in blood vessels in the cells, that is the first picture you can notice down. You don't have any disturbance, your blood is flowing normally, that is that is it follows a laminar flow direction. Okay, so there is no disturbance, it has a normal blood flow. Next, we are going to place what your apparatus, that is you are going to place the cup over your the arm. Okay, so here you have a brachial artery, that is our target of or you can say area of interest. So here we are going to measure the brachial artery pressure. Okay, the reason why we have chosen this brachial artery means, compared to the lower arm, we can measure BP wherever we want. The reason why we have used this particular position as a common in the sense, this upper arm is very feasible and accessible to measure BP, and a patient also will feel comfortable while they are taking the BP. And also this is almost close to your heart, that is it covers proximal side of your heart. So whatever the reflection you are getting with the help of this brachial artery, it always related to your artery vessels of your blood, your heart. So that is the reason the main we have focused this brachial artery compared to the other arteries. Okay, we know the and also the brachial artery is one of the large artery you can see in your upper arm side. So that is the reason we are focusing this upper artery. It means that above 2 inch from above the elbow, that is 2 inch above the elbow, you have to place the cuff over the brachial artery, and then after tighten the cuff, you have to press the bulb. Okay, so you have to press the bulb until until the mercury level is above 180. Okay, so that is above 150 something. The reason is that the cuff pressure always here you have to give at the maximum level compared to your systolic pressure. You know the systolic pressure is 120, then what is the maximum pressure you have to give in the cuff means above 120. That is the thing you have to fix here. Okay, so once your cuff is inflated with the air, that is above 120 pressure. Now see your blood vessels and how the blood is flowing in second diagram. Okay, so when you are giving so much pressure by means of cuff pressure, your blood vessel is being shrink. Okay, so it's getting occluded. It means that now the blood is not finding way to flow. Okay, so this is how it's happening when you are doing inflating the cuff. That is the first stage of measurement. So next you are going for second stage, where you are going to start to read systolic pressure and diastolic pressure. That is the second level of measurement. Okay, now what you are doing after you are inflating your cuff up to the level of 130 or 140 mmHg. Now you are going to slowly release your bulb. Okay, the screw which is over the bulb. So when you are slowly release the screw, automatically your pressure will start to get dropped down slowly. Okay, so what is happening now, that now the cuff is started to in deflate. Okay, so before it is like shrinking your blood vessels due to the high pressure. Now since the pressure is getting released, now the blood vessel is regain its original pressure, original size slowly. So what is happening now, the blood inside that blood vessels will try to find some path to flow heavily. So what will happen here, the direction of the blood flow, okay, will get affected. So now the blood will undergo turbulence flow, because it have very small path to travel. In previous case, it doesn't have any path to travel or to pass through, so it gets stopped, that is get occluded. In second stage, when you are releasing the pressure, now the blood is finding the way, right, finding the way, some path, finding the way to at minimal path to try, so the blood is trying to escaping from that area. So it is like following, it is like flowing in a abnormal way, like it follows zigzag directions. Okay, so in that case it will hard, it will hit the blood vessels very hardly. So it will make the blood vessels so vibrate. So that is the reason you will head we will start to hear one sound. Okay, that sound will be heard with the help of stethoscope. Okay, so we have stethoscope that will be placed over the cuff, that is where you are measuring the BP. Okay, the just beneath the cuff, and you will start to hear the sound. Okay, so what is happening, when you are slowly releasing the pressure, at one point you will hear the sound. Why you are hearing the sound? In the sense, because of this changes in blood flow. So now the blood is following a turbulence flow. Because of the turbulence flow, it's hitting the blood vessels very hardly. So it makes the blood vessels to be vibrate. As a result, it making some noise like whoosh, that like that sound. So the point where you can hear the sound, which is nothing but systolic pressure, because that is the moment you are releasing, so that your blood is flowing hardly. So it means that that is the moment you had heavy contraction, that is a maximum contraction. So that is a point we call systolic pressure. Okay, so what is happening next, you are keep on releasing the pressure. So now so now your cuff is deep deflate completely. So now blood vessel is regain its original size. Okay, the original size. So now the blood is after some time it's finding its own way. So it's moving so freely as like before. That is the initial stage. Okay, that is before placing the cuff. How does it flows? As like it's flowing now, since all the pressure is being deflated. Okay, all the pressure is released, so the cuff is also deflated. So now what is happening, at one point, okay, initially you heard one sound, that is systolic pressure. When you are keep on releasing the sound, at one point you will no way going to hear the sound, that is the sound will get stopped. That point is nothing but is the systolic pressure. Okay, so diastolic pressure, it means that your blood vessels, that is it's being relaxed. It regains its original shape and size. So there is there is no other way, there is a easy way for the blood now to flow, so that you can't hear any sound anymore. That is the reason the sound is getting disappear at this point. Okay, so the point where the sound is getting disappear, that point is called diastolic. So this how they will analyze, they will measure what is the systolic pressure and what is diastolic pressure. The point where you can hear the sound, that is the systolic pressure, that is the point you have maximum contraction of the blood vessels. And the how you are hearing that sound means due to the vibration of blood vessels. The reason is that the blood following turbulence flow, so it hitting the blood vessels very hardly, so that it make the blood vessels to be vibrate. As a result, it producing some noise. That noise is nothing but Korotkoff sound. The how this name has been given, this sound is nothing but by means of like one scientist, Nikolai Korotkoff. He is the one found this particular sound when doing this experiment. So they simply naming that sound is called Korotkoff sound. So the appearing of sound is the point called systolic, and disappearing of the point is called diastolic. So this how the basic principle is follows in order to measure the BP. It's a very simple. So this follows the four I have given in four pictures detailing about how normal blood flow will be there and what will happen when you are place the BP apparatus, that is in initial stage when you are giving very high pressure, that is cuff pressure should be greater than systolic pressure, and then what happened when pressure is releasing very slowly. So one point you will hear the sound when you are slowing the pressure, so that sound is called systolic pressure, and one point the sound will get disappear, that point is called diastolic pressure. So this is the basic principle of blood pressure measurement.